Good morning, everyone, and welcome to this virtual presentation of the 2021 Healthcare Outlook. My name's Matt Morrow, and I serve as president of the Springfield Area Chamber of Commerce, and it's my pleasure to welcome you joining us today virtually. As the economic development arm of the Chamber of Commerce, the Springfield Business Development Corporation hosts 3 Outlook events each year. 2 are centered around trends in healthcare and manufacturing, industries that make a significant impact on our local economy. While the 3rd event, the Economic Outlook, takes an in-depth look at the overall economic forecast. Through these Outlook events, we aim to provide an understanding of what's driving and what's challenging our regional economy and its future growth. We have a great program lined up for you today, and I think you're going to really enjoy it. But before we get started, we'd like to begin by recognizing the organizations that help make today's event possible. And we want to begin by recognizing our presenting sponsors, Cox Health and Mercy. Also, our gold sponsors are Burrell Behavioral Health, DeWitt and Associates, Healthy Living Alliance, J.E. Dunn Construction, Kutak Rock, AIDS Project of the Ozarks, Bluebird Underground, Brandco Enterprises Incorporated, and Drury University. Also, Dynamic DNA Laboratories, Essence Healthcare, Paragon Architecture, and Preferred Family Healthcare. And we also have several corporate sponsors for today's event, which you can see on your screen as well. For all of our sponsors, we're very, very grateful for your support of the 2021 Healthcare Outlook event. I also want to take just a moment to thank our SBDC investors. You are the companies and organizations that have gone above and beyond your Chamber of Commerce membership to financially invest in and support the economic development, workforce development, and placemaking efforts of the Chamber of Commerce. You understand that economic development is a team sport, and that together we can make Springfield an even better place to live and work. If you're tuning in today and you haven't yet connected with us on supporting these efforts to grow jobs and Springfield's economy, please let us know. We would love to have a conversation with you about joining us to make these things happen in and throughout our region. Together, we can always accomplish more. Well, today's program will look at ways that the healthcare industry impacts our region beyond the high-quality care that's provided to patients. The past year has certainly put healthcare top of mind. It's likely that not a day has passed in recent months where healthcare wasn't very much in our thoughts. But one aspect of care that has come into even greater focus during the pandemic is mental health. To provide insight into the importance of mental health today, we had a conversation with Caitlin Lenhart, who is Vice President of Human Resources at Burrell Behavioral Health. So let's take a look.
Hi, I'm Caitlin Lenhart. I'm the Vice President of Human Resources at Burrell Behavioral Health. I lead a team of HR professionals that help support 1,800 employees across 17 counties in Missouri and 8 in Northwest Arkansas. Burrell offers outpatient therapy and outpatient psychiatry services, but also a wide variety of substance use disorder treatments for both youth and adults. We also offer some specialized services for our youth populations, such as autism and ADHD. And then a lot of our services are actually integrated in the community, in schools, in medical clinics, doctors' offices, and through partnerships with judicial and social services. Everything has changed here recently in the last year, and mental health has become the forefront of that conversation. So while COVID is a negative, the focus on behavioral health is absolutely a positive. People are now beginning to realize that you don't necessarily have to have a chronic mental health issue in order to seek care. We are turning the conversation that it is great for wellness, for relationships, just even if you're going through a hard time. We all need support, and that's totally okay. So something that we launched was the Be Well community. This is a daily live stream that's led by licensed psychologist Dr. Shelley Farnan, where she leads us through some different things for mindfulness, meditation. She shares self-care tips, just to help us focus on wellness as we're going through this tough time in our world. Another thing that we've focused on this past year is really access to care. So telephonic and telehealth services have increased, and now our clients can access care anytime that they need it, wherever they are. Burrell offers more than just the traditional, you can go access a therapist or a psychiatrist if you need one, but now we're really focused on prevention. So focusing on those self-care tips and tricks that we get through the Be Well community, but also that is becoming more more focused on business and what our employees are going through. They're all navigating something completely unique, and this will help them through that. Everything has changed this year, and every single person has been impacted at least in some way. The change fatigue is absolutely real, and the focus on mental health is becoming more important now than ever as we are all trying to navigate difficult decisions for us, for our workforce, for our coworkers, and for our families. The pandemic has really changed how we work. A lot of industries have transitioned to a remote workforce that typically wouldn't have in the past. So it is really critical to determine how do we engage our employees while we're completely physically distant. And that is going to be important to learn now, because after the pandemic, this might be something that sticks around. So creating virtual opportunities for employees to connect has really helped Burl employees stay connected. So having those different forums where they can have honest conversations, share feelings, engage in mindfulness and mental health wellness exercises together has been crucial. Something else that is important right now is employee engagement needs to be a focus this year. So our employees will always remember how their employer navigated through COVID-19. And this is something that we need to continue focusing on in the future as well. Employees want to feel safe, supported, connected, and we can make that happen even in a remote workforce. And the biggest shift over the last year is determining how do we take care of our employees in a very unique way, where their whole world is being flipped upside down and they're having to figure out how do I maintain my full-time job, take care of my children while they're in school remotely, make tough decisions for families about whether they go out in public or not. There's a lot of unique things that have been different, and as an HR professional, we've had to pivot like never before. Our employee engagement strategies are different. Our wellness and benefit strategies have changed over this last year to be able to accommodate some of those things that we did not even think would happen back in 2018 or early 2019. So it's all been new. At Burl, we have focused on transparency through the pandemic. We have truly asked our employees, what do you need? What support do you need? What would you like to see? And then when our employees answered us, we had to act on it. So that would be what I would recommend as a nice entry point, is create that space for a virtual open conversation and then act on the feedback. Create an action plan that will help get some of those wins that your team is looking for. By having Burl here, you have access to care 24/7. We're here to support our employers in the community as they are embarking on their mental health wellness journey, whether it's through self-care with the BWAL community or through an EAP service. Burl's here to help.
Well, thanks so much, Caitlin. You know, employers have had to navigate it very carefully through this pandemic in many ways, including in finding ways to meet unexpected staff needs through it all. The resources and tips that Caitlin just shared can certainly be applied in our climate today and likely well into the future as well. I want to thank Burl and other organizations in our community for working to help shine a light on the importance of mental health, not just today, but every day. While employers work to keep business thriving and staff healthy and supported, we continue to see an increased need for healthcare workers. Today, we get to hear from a handful of local educational institutions that are working to fill the constant need for physicians, nurses, EMTs, and other medical staff in our community. We sat down with Dr. David Haustein, who is Associate Dean of the University of Missouri School of Medicine, Springfield Clinical Campus, and with fourth-year medical student Allison Hall, to better understand physician training that is taking place right here in Springfield and the impact that this training has had on our local healthcare industry.
My name is David Haustein, and I serve as the Associate Dean for the University of Missouri School of Medicine Springfield Clinical Campus. The University of Missouri School of Medicine can take in 128 students per year. Seeing that there was such great clinical volume in Springfield between Cox and Mercy, that was a logical place to place third and fourth year medical students. So about 4 years ago, the campus opened down here in Springfield with just 9 students initially, but we've gradually grown to now having 49 students in place that are training at Cox and Mercy predominantly.
My name is Allison Hall. I'm a fourth year medical student at the University of Missouri School of Medicine. I was born in South Dakota and finished high school in a small town in Missouri near Rolla. I knew I wanted to pursue healthcare in some aspect. Ultimately I decided I wanted more of a provider role. I was working as a scribe, and seeing that firsthand in the emergency department made me really want to pursue medicine.
During your third year of medical school, you get trained in a variety of disciplines. Here in Springfield, during their third year, they rotate in child health, obstetrics, gynecology, family medicine, internal medicine, surgery, psychiatry, and neurology. And so they go through these experiences spending about 8 weeks learning each of those disciplines. And so the quality of their education is extremely important. Usually in healthcare, when a person is trained, they look to their mentor and trainer for so much guidance there that whatever that trainer is doing, that's frequently what mirrored in the student's practice. And so it's extremely important for that training to be of the highest quality. Right now, they're predicting that in the next 10 years that there will be a physician shortage between 50 and 140,000 physicians. And so MU has known that training up physicians is going to be a priority. Springfield is a really special community, so the healthcare volume that Springfield experiences is pretty astounding. Between the two health systems, there's almost 2 million outpatient visits per year. There's over 6,000 deliveries, I think over 76,000 surgeries. So the clinical volume that's happening here in Springfield is pretty remarkable.
I did my undergraduate degree here. I was familiar with Springfield, and I knew that it would be a good place to train. It's a level 1 trauma center. We have a great patient base. There's a component of underserved communities here. Not having residents here is such a unique experience for medical students because we get to work one-on-one with the attending physicians. We get to learn from them directly. We also get a lot of hands-on experience in caring for patients and having a lot more responsibility than we might have ordinarily as a medical student. Here, without the residents, you're doing more of the procedures, you're talking to patients more, you're presenting your assessment and plan directly to the attending physician, and so you're more responsible for the patient's care and plan in a community setting, whereas in a university setting, you might be having a lot more discussions and team meetings and kind of learning in that environment. The big reason that I really wanted to come here was that I wanted to kind of have that one-on-one experience where I needed to know exactly what I was doing. And then also just the community in Springfield is such an interesting population of people who really need healthcare. We have such a large rural area where people are traveling for hours to get here to get basic health care, as well as the experience at Jordan Valley Clinic. We've had such a wide variety of experiences. I had the opportunity to rotate at the Federal Medical Center for U.S. prisoners for my psychiatry rotation, and really just a robust and unique experience compared to the typical 3rd and 4th year rotations. We all learned how to be very flexible and adapt quickly to the changing kind of educational environment in the healthcare setting. We did a lot of telemedicine rotations initially in March and April, as well as I think into May before we were able to get back into the clinical environment.
With the pandemic, it's been really interesting. Our students had to pivot from a lot of in-person experiences to some Zoom and virtual experiences to interview patients and learn their skills. The student experience is largely unchanged. If anything, they actually seem to have more experiences and more tools in their toolbox because they are so adept at telehealth now and experiences seeing patients virtually. So the students have really been resilient and continued on with their education just pretty much as normal. In America, there is a need for primary care physicians and subspecialists as well. So I feel like the projections of what we will need in like 2033 is a variety of disciplines within medicine. We're thankful that at the Springfield Clinical Campus, we have had 100% match rate for our students here. They get incredible training through Cox and Mercy, also our other places in town, Jordan Valley, FedMed, and Burrell. Once they have done their residency training of 3 to 7 years, we hope that they'll return to this area and be a part of the quality medical community that exists. We started this campus in 2016, and initially we just had 9 students, and then 10 and 11. Well, our 4th year medical student class here in Springfield has 28. So while we have graduated about 30 students before now, as of May of this year, that number will double from 30 to 58. Medical school residency training is 3 to 7 years, and so our very first class that graduated from here in Springfield will actually be finishing residency, if not this year, then in the following years. So we're really expecting to gain some traction for physicians to start coming back to this area. We have had, in our very first class, we had a student who's from this area, and he decided to go train at Mayo Clinic in dermatology, a very respected program, and he has committed to coming back here to Springfield and signed on with a local hospital to come back. And so he's one of our first success stories of people, of someone who's going to come back to this area. But we have several other students that have already graduated and that are in our classes right now that say, I want to come back home. So we're excited to have those stories to share in a few years.
I would absolutely consider coming back to practice in Springfield. Having lived here and worked here, I think the patient population is amazing. I think this is such a unique healthcare community in terms of having two different hospitals that both have incredible opportunities in terms of providers, and the ability to establish a practice here would be a great opportunity for me.
Our current M3 class is the most diverse class we've had here in Springfield. We have about 17% underrepresented minorities on the Columbia campus, but that's never been quite mirrored here in Springfield until this year. And talking to our students that come from a diverse background, they say they're having an incredible experience, and they may have had some hesitation about signing up to come to Springfield, but the reality that's playing out is they are having an incredible time. We have over 350 physicians who are faculty for University of Missouri here in town, between Cox and Mercy. A lot of them are at the assistant professor level, but they're volunteering their time to spend with our students. And physicians are very giving people, and a lot of them are natural teachers. And so to hear their stories about how taking on a young student has reinvigorated their career and been able to feel like they're giving back to the next generation, that's really encouraging. Not only are our students incredible, but our faculty are incredible as well, raising up this next generation.
It's really so exciting to hear how we are training our next generation of physicians right here in Springfield. But of course, physicians aren't the only area of medicine where there is a need for a trained workforce. Dr. Tracy McGrady, Provost and Vice Chancellor for Academic Affairs at Ozarks Technical Community College, met with us to talk about workforce shortages and how educators in Springfield are working to train healthcare professionals to meet those needs.
I'm Tracy McGrady. I'm Provost and Vice Chancellor for Academic Affairs at OTC, and we offer a wide variety of healthcare programs. We have 18 of them in all. Some of them are on the degree side, some of them are on the workforce development side that are the shorter term training programs. We have everything from nursing to medical assistant to pharmacy tech, health information, technology, just the gamut of programs, a lot of different options for people to pursue. Some programs are smaller. We have around 20 students in a program, and some are much bigger where we can accommodate 80 students or more. All in all, we graduate around 600 students every year between all of the different programs. The pandemic has certainly highlighted some of the shortages that we know are just ever present. For instance, there is a tremendous shortage of respiratory therapists. There was before the pandemic, and that's just been highlighted now. Also nursing, of course, CNAs, medical assistants. And so some of the ways that we have tried to address that is building awareness of these different programs, because a lot of people just aren't aware they exist, but then also, especially through workforce development, being able to provide those short-term training opportunities so that students can come in and just a few weeks be trained in order to go out and to work and be very well qualified to go into the workforce. We have seen a significant growth in EMT And we also have seen significant growth, again, in nursing. We always try to expand the number of students that we can bring into our nursing programs. Also medical assistant. I believe that we will see an increase in paramedic simply because of the increase we've seen in EMT, and paramedic tends to be kind of the next step. We are fortunate because we do have medical simulation that we use, and this is where students are able to work on those high fidelity mannequins, the ones that breathe and talk and bleed, and it creates more of a real life, real patient care experience that students can have. And that helps to really supplement then what they do whenever they get out into the clinical space. But the other piece of this is really making people aware of the variety of healthcare programs that they have to choose from. People know about nursing, they know about paramedics, but there are some fields that they just don't even know exist. A great example of that is surgical technology. There is a tremendous demand for very highly trained surgical technologists right now, and it's really hard because people, they just don't know that it is even a job. They think that the person who's assisting the surgeon in the operating room is a nurse. They don't realize that that's someone who's specifically trained for that job. So that's something else that we really try to do, is build a lot of awareness of all the different types of programs that we offer. It is fundamental, and that cannot be overstated. Healthcare tends to be a big employer, and so people from any socioeconomic background have the ability to become trained to work in that industry in really a relatively short amount of time. We have programs at OTC that run anywhere from a few weeks to 2 years. Another way that the healthcare industry is so important is that it contributes directly to that quality of place. You and I are not going to move into an area unless we know we have access to high quality healthcare, and we're certainly not going to stay there. So not only does it attract people into a community and really help to build the economy of a community, it also helps people continue to stay there. And we at OTC understand that the role that we have is we have to try to sustain that and be part of sustaining that. And that's the piece that we really think about in terms of our responsibility to the community.
Today we've heard about the importance of care, particularly in the area of mental health, and we've learned about how area professionals are training a healthcare workforce to deliver the high-quality care our community needs every single day. But as I mentioned earlier, the impact of the industry goes well beyond patient care. Behind the scenes, healthcare contributes to our local economy in very significant ways. And to help us gain a better understanding of the impact of healthcare-related construction, J.E. Dunn, their Springfield office leader, David Atkinson, is going to share with us a little bit of information about how that has impacted our economy. And along with him will be Executive Director of Planning and Design and Construction at Mercy, Geraldine Lynch. They took some time to talk with our team about recent construction projects. So let's see what they had to say.
I'm David Atkinson. I'm the Springfield office leader for J.E. Dunn. Some of the roles that I fill include being that outward face for the company, doing business development and bringing work in the door, building relationships. I'm usually involved heavily on the front end, getting the project set up for success. And then once we get into the construction phase, I'm involved in providing leadership to our construction teams through that phase as well.
I'm Geraldine Lynch. I'm the Executive Director of Planning, Design, and Construction for Mercy Ministries. My role is for the management of all new construction and renovation across our 4-state region. Well, it ranges, but we do about 350 projects a year, and that's about 60 in the Springfield area, so about 15 to 20% for Springfield. Probably
20% of our total revenue is healthcare construction on a national perspective. Here locally in Springfield, we were part of 8 healthcare specific projects this past year, and those projects made up about half of our Springfield revenue for 2020. You know, when your client's business is deemed essential and your business is deemed essential during a pandemic, it creates a very different but a very busy year. And our healthcare revenue was about half of our total Springfield office revenue. And that percentage is higher than normal. We're usually a little bit more diversified in the type of construction we do between education and healthcare and offices and governmental work. But there was just a really strong demand for healthcare projects this past year for a number of different reasons.
So I don't think we actually added any new jobs. What we did was sort of pivot our workforce to take care of our pandemic projects. And there were approximately 12 COVID-specific pandemic projects here in Springfield, and there were about 3,000 craft hours for that. The cost of those projects was about $500,000, and to put that in perspective, the Springfield region over the last 5 years spends about $40 million annually on construction. There are ancillary impacts of all the construction workers traveling to the job site on a daily basis, the gas they use, the restaurants they frequent, and the wages of all those construction workers that are spent in the local community. You know, there is no working remotely in the construction project. The tradeswomen and the tradesmen and the professional staff have to come to the job site. And in our case, the job site is the hospital.
The reach of the healthcare industry is almost endless. You know, just within our small Springfield office alone, that provided dozens of job opportunities for J.E. Dunn employees. And then when we look more broadly at subcontractors we like to call trade partners, and then you look further at the other critical aspect of all of our project. It takes our clients, it takes our construction teams, but obviously those design teams, those architects and engineers. So when you start adding those up just in the design and construction industry, there are literally hundreds and hundreds of jobs that exist because of the healthcare industry. Cox Health has been a great partner for us this past year. At their south campus in the West Tower, when that space was built originally, it had some shell space on a few different floors, and we did a number of projects in there this year to infill, to utilize that space as well. We definitely had a new project come along for Cox Health in response to COVID to construct a COVID ICU, and they reached out to our team, asked us to help them develop a plan and execute that in very short order. It's a 51-bed ICU, and the whole project came together from concept to reality in about a month. Then, unfortunately, due to ongoing and increasing demand throughout the year, we dropped back and then in December expanded the COVID unit with another 31 beds in a very similar fashion as the original build out.
We continued and we instituted safety protocols for our contractors so that we could continue working during the pandemic. There were many unexpected projects due to COVID. Some of those were temporary testing collection sites, the forward emergency department, triage trailers where we place trailers outside our existing EDs to help with the patient volume and the patient throughput, projects within the hospital to increase bed capacity, modify the existing patient rooms and procedure rooms, installation of plexiglass, among others. We also converted our inpatient rooms to negative pressure. We went from 78 inpatient rooms with negative pressure to 267 currently at the Springfield Hospital.
Quite literally, every direction I turn, every group that I'm a part of has healthcare professionals sitting at the table, giving back, contributing, donating, serving, looking for ways to improve the organization or improve our community. I serve on the GoCaps board. Well, who are some of the most prominent and heavily engaged and involved members of that program? It's our healthcare providers. The SBDC, who are some of the most heavily invested members of the SBDC. Once again, it's our healthcare providers. So they're quite literally at the table of everything that's happening and making a positive difference. It's really hard to think of an aspect of our community that they're not making a positive difference in.
It really is so incredible to consider and just think about the enormous and broad economic impact that the healthcare industry has on our community and on our entire region. And to continue that discussion, we are joined here live today by President of Cox College, Dr. Amy DeMello, President and Chief Operating Officer at Mercy, Brent Hubbard, and Jill Williams, who is Vice President of Workforce Initiatives at the Missouri Hospitals Association. Amy, Brent, and Jill, very, very glad that you could be with us today. Thanks for joining us. We have some familiar faces here and some who might be new to our audience, so I don't want to miss the opportunity to let you introduce yourselves and tell us a little bit about your background and your role at each of these organizations. I'll just start to my immediate left. Yes, congratulations, Amy. You're first up, batting leadoff here. Tell us a little bit about yourself and the role at Cox College.
Sure. So as you mentioned, I'm president of the college. I'm starting my 7th year at Cox College. I love it immensely. Prior to that, though, I spent 20 years in K-12. So wonderful transition to higher ed. But, you know, education is education. So I love it there.
Very good. Brent, tell us about your role.
Well, thank you, Matt, for having us. Again, I serve as the president and COO for Mercy Hospital Springfield Communities, and what that entails is just administrative support for our hospitals across Springfield communities, which includes Springfield, Lebanon, Aurora, Cassville, and Mountain View hospitals. So I've spent 19 years of my career and professional life in healthcare, and it's been exciting, and I think the next 19 years will be even more exciting.
Think of the dog years of education we've had in this last
that's right.
12 to 18 months, right? Jill, I'm going to turn to you next. Unless you're in healthcare, you might not have a close familiarity with the tremendous work that Missouri Hospitals Association does in our state. Talk about that a little bit, if you would.
Thank you. Yes, Jill Williams. I'm Vice President of Workforce Initiatives with Missouri Hospital Association. I've been there about 4.5 years now. My background prior to that was working in human resources in both banking and healthcare. But yes, the main part of my job, my role, my focus is to foster collaboration among workforce stakeholders throughout each region of the state. So bringing together those in education, our hospital human resources professionals, our Missouri job centers, chambers of commerces locally, and just really working together to discuss programs, share best practices, and anything that we can do to make that pipeline, to work together to develop a pipeline of qualified workers. And of course that through the pandemic, other things have been added to the plate of working with our hospitals on staffing solutions, also coordinating vaccination of employees and things like that. So it's been just a whirlwind of a year for sure.
Yeah. I mentioned just a moment ago how much it feels like that whirlwind has been so accelerated. There's been so much learning take place during this time. Brent, there's probably never been a time that I can think of, at least in my life, never been a time when our day-to-day attention, even people who are not in healthcare, our day-to-day attention for such an extended period of time has been so focused on healthcare. And I think as you have been, as others have been innovating during this time, I suspect you're probably identifying some trends, some things that might be with us for months to come, might be with us for years to come. And this is an Outlook event, so talk to us a little bit about what you see as we go out a few months or even a few years.
It certainly wasn't our intent to be the focus over the last 12 months, right. But that's the reality of the pandemic, and I think over the next few months it's very encouraging, and we're cautiously optimistic of what is to come with the pandemic and being able to come out of the pandemic here in the next few months. And so our projections are showing that our COVID hospitalizations and COVID positive cases will continue to trend downward. We do have an introduction of new variants across the United States that could slightly impact the number of hospitalizations we may experience over the coming months, but at least through August, we continue to see a downward trend in COVID hospitalizations and expect that. We don't see that changing, but what is imperative is that we continue to get vaccinations in arms. And if we can continue to do that across Southwest Missouri, we will keep COVID at bay. I think COVID will be with us probably for our lifetime, but how we work within COVID will be probably very similar to how we deal with the flu today. And so there's a lot, I think, a lot to look forward to over the coming months when it comes to the pandemic. Long term, you look at the next few years in healthcare, I think a major theme we'll see in healthcare is change.
Yeah.
and how rapid change will take place. And we were talking about this even before the pandemic and expecting the rate of change over the next 5 years in healthcare to be at a steeper trajectory than it has been over the last 15 to 20 years. Now, that was before the pandemic.
Right.
So since the pandemic, we've probably compressed 5 years of change into 1 year.
Right.
Which there's a lot of benefit to that. That's the benefit of the pandemic. If there's anything good that has come out of it, is the rate of change and the change that needed to happen in healthcare. There are three, I think, aspects of change that are a result of the pandemic, but also what we would expect in the next 5 years in healthcare. Number one is consumerism. Okay. We need to make navigating healthcare easier for healthcare consumers and our communities. And so that will continue to be a theme, and being able to provide access and convenience, and then also pricing. Those are the three things that our communities tell us that are important to them when it comes to healthcare. And so consumerism is number one. Number two will be the adoption and use of technology and virtual medicine. Virtual medicine is not new in healthcare. But the adoption and the rate of adoption is much faster than it has been over the last 7 to 10 years. Fortunately for Mercy, we invested in the nation's first virtual care center about 7 years ago, so we've been prepared for this, and it's kind of an exciting time. Who would have thought that we would be spending time with our physicians through a virtual visit? Mm-hmm. Right now, 13% of our overall physician office visits are through virtual visits. Yeah. And so that will continue to increase over time. And then lastly, and I know we'll probably talk a little bit more about this in the discussion ahead, and several prior to us have already discussed this, but the workforce. Right. The workforce, I think, demands, and then also the expectations of the workforce is changing rapidly, and we'll have to adjust to that as well.
Well, you sure teed that up well. I think it just begs me to go to you, Amy, next, right? So I want to unpack a whole lot of that, and we will. But just starting with the last part, workforce. Sure. Big year for Cox College, record enrollment, new facilities opening up, everything else. Talk to us a little bit about I guess maybe the role that Cox College has in helping to prepare that future healthcare workforce. The demand is great. The need is significant.
Yes, you have absolutely said it. And that is the purpose and function of Cox College, is to provide you with the healthcare workforce that you need. And so we've done a few things like petition the state board to take more nurses. We can take up to 400 nurses in an academic year. So we are, reaching that mark, which is wonderful. However, at the same time, as you talk about consumerism in healthcare and convenience, we find those same themes in education. Right. And we have heard earlier today in the program about the stresses on families prior to COVID-19, and then certainly after COVID-19, where families are at home, working from home, maybe teaching their children, helping them with school, making sure that their children get to virtual class. So maybe, this would be a difficult time for them to go back to school. However, because we know that we need to provide convenience for students, we have embarked on a night and weekend program for undergraduate nursing. That program started 3 years ago prior to COVID-19, and we had 5 students enrolled. We have 95 now. Wow. It is our fastest growing program at Cox College, and it is, I think, because it works around families who say, yes, I want to be a nurse, but I can't quit my day job, or I can't, not take care of my children, but certainly going to class on a Wednesday night and clinical on a Saturday really, helps to do that. So we're trying to be very responsive to the needs of the healthcare community, while at the same time trying to meet our students' needs as well. So that's always a delicate balance.
What a testimony, though, to be able to be nimble and responsive like that. I mean, the bottom line is well-trained healthcare professionals in the workforce, and if that means we do we do more flexible scheduling, whatever else, just to see the responsiveness.
Yeah, that is what we have to do. And we've heard earlier in the program about the rate of change and rapid change. Certainly, COVID-19 has forced higher ed institutions to embrace virtual learning, virtual office hours with your professor, everything that you can think of virtually. Right. And we did that in a semester.
Right.
For those of us that are in higher ed, previous to COVID-19, that probably would have taken a lot of discussions and a long time to get that change done for our students. But I guess the benefit of COVID-19 is that it forced you to change.
Yeah, no kidding. Jill, I want to come to you next, if I can, on the work that Missouri Hospitals Association is doing. You cover initiatives across the state. I wonder if I have a couple of questions for you. One's in the script, and then I'm going to surprise you with one. Not a big curveball, but I feel like we have to talk about some of these issues that have come up here. So just let me start with this idea of workforce, since we're talking about this. The workforce landscape in Missouri right now, statewide. How would you describe it? Are hospitals still, how acute is the need for trained professionals in healthcare?
Yes, well, as many mentioned already, demand is outpacing supply. So I'll touch on a few issues. One of the things that was mentioned in the video, I think from OTC, was talking about the short-term training programs. So if we look at the state of Missouri overall, most of our, I would say 9 out of our top 10 most in-demand careers require just short-term training. So on-the-job training, a certificate, less than 2 years of education, or 2 years or less. But I'll also hit on the need for nurses. So in 2020, job posting for nurses were at an all-time high. We also have several nurses in the workforce right now who are nearing retirement age, so that's a big concern as well. We have a need for nurse faculty. We have a nurse faculty shortage. Again, many of those faculty are also nearing retirement age. So we have nursing schools who are across the state are having to turn away qualified nursing applicants because they don't have enough faculty or clinical sites, classroom space, budget, etc. I would also say in nursing, this year we've really had a huge influx of nurses that have maybe left hospitals to go work for travel agencies for sky-high wages. So we've heard that.
Right.
We've seen it in the state. We've heard it on the news and other things. So that's a concern and an issue as well. As mentioned before, we have a physician shortage, a looming physician shortage, especially in primary care and especially in rural areas of the state. I also wanted to touch on telehealth. That's been talked about.
That's what I was going to ask you about.
That's been talked about quite a bit.
Good. Well, I'm glad. See, no curveballs.
Yeah,
I knew you were probably thinking.
So, through the pandemic, telehealth is becoming more commonplace than it was in the past. And regarding workforce, that's just something that, physicians and their staff are going to have to learn to be trained in a new way. So they're going to need to be trained on this new technology and trained on how to communicate with patients in a different way. And then I would also say employee well-being. That has been mentioned as well, but it is very important. So amidst the pandemic, we've seen several frontline workers and clinicians who have really been, at the brink of burnout and both just physically and emotionally exhausted. So it's really important for hospitals and healthcare organizations to identify those individuals that need help and be able to provide that mental support for their mental health for those staff.
So I'm going to come back to what you mentioned in telehealth. For people who are in the healthcare industry, you know that the Missouri Hospitals Association is a fierce advocate for the needs of patients and the healthcare industry at the state level. I know that it has been a part of MHA's agenda for a long time, legislative agenda, and it is for the Chamber of Commerce legislative agenda as well, to expand access to broadband internet in rural areas in particular. Yes. I guess I would ask you to talk just briefly about how important is that, particularly when we're talking about things like telehealth and delivering education and training for people who might live in those areas.
Yeah, it is. can't stress enough how extremely important it is for those two reasons. Especially those individuals in rural and underserved areas. I mean, those are just at a high need. And over the past several years, we've had some hospitals in the state close in these rural areas. So access to care for individuals in those areas are just getting, harder and harder to come by. So the more we can expand broadband and those opportunities for those telehealth conversations and visits, and also for our students who are wanting to learn and be able to use simulation and may not be able to visit a hospital for clinical sites and be able to experience things in new and different ways that they might not have had access to in the past is so important.
Great, good. Amy, I'm going to come back to you. I know, so we hear Cox College, and people who are maybe work closely with it know this already, but many may not. Your students, of course, don't just go to Cox Health. They go all over the region and really all over the country and perhaps the world. But talk for a moment, if you could, about your affiliation with Cox Health and how the affiliation with a major health system like that provides unique opportunities for your students.
Sure. It's just that. It's access to that training that students need to be ready to go from day one. So while we know that we have to use virtual simulation now, and we have because of COVID-19, and we know that there is somewhat of a demand from students to have some virtual education. It can't be all virtual. Yeah. And so, having access to a level 1 trauma center, having access to all the healthcare professionals you could possibly imagine really helps our students be ready to go on day one when they get a much needed job and fill a vacancy in all the area health systems.
Jill, I have to imagine that the way that health systems and hospitals in the state look for talent, recruit talent, is probably evolving pretty rapidly. Could you talk a little bit about how the pandemic maybe has changed the way hospitals look for talent, and maybe what you anticipate that looking like in the future?
Sure. Yes, hospitals are still looking for talent, that's for sure. We had shortages prior to the pandemic, but I think COVID-19 has only exacerbated those shortages and made them even greater. And we're looking for new roles. So hospitals are hiring door greeters and temperature checkers, vaccinators, telehealth workers. And I think as many businesses have maybe closed their doors, that's made the healthcare occupations look more attractive. And as we're seeing and hearing from our educational partners is that we're having an increased number of enrollments across the state in the healthcare program. So that's really great news as well. And like you mentioned, I think, actually looking for talent in human resources and interviewing and those types of things have changed during the pandemic and will stay. So human resources professionals and recruiters just have to be so much more flexible in how they are connecting with candidates. And I think that's new not only for the interviewer, but for the candidate as well, how to interview online and talk through email and text in a professional way. So all of those things are changing, but I think it is too just so important, and even more important in the future, is that we continue to recruit a diverse talent pipeline. Right. So racially diverse, also people with disabilities, veterans, individuals who maybe dropped out of high school. How can we get them their GED and get them trained at the same time? Maybe we need to look at people who are formerly incarcerated or others with those different types of barriers to employment. So I think that's really important. And I'll also just lastly say that I think that our health stations really won't be able to just wait for people to walk in the door anymore. We really need to reach out to those in middle school and high school and get them introduced to healthcare careers. But also we're seeing a shift to where we're having to, in order to recruit talent, we also have to pay them while they're training, pay them while they're in the classroom. And look at those earn and learn models like apprenticeship programs, career ladders, flexible scheduling, as you mentioned. And what are those training programs we have for those who maybe this is their second career, second career choice is coming into healthcare as a new employee. How do we get them trained? So just I could go on forever, but just lots to come.
Have to be really creative, it sounds like, and we are certainly not at a point where we can afford to leave any talent on the sidelines. If there's a way to access that talent and to prepare and equip, we just have to have to explore it in a very multilateral approach, it sounds like.
That's right.
Brent, I'm going to come to you. You mentioned 3 areas that are really key for trends going forward. I want to ask you to maybe talk to us a little in the same vein, a little bit about some of the key indicators or information that you're watching that'll kind of tell you as an operations planner. What is this? What are the things you're watching that will tell you how to prepare for the months and years ahead? And then maybe, what does a community like Springfield need to be doing to help support the healthcare industry that's so important to us?
Right. That's a great question. And as it relates to consumerism, so healthcare has followed for years what the retail industry and banking industries have done. Typically, healthcare has been anywhere from 5 to 10 years behind the actually banking industry and retail industries, and so they continue to be a leading indicator for us. There are other indicators we use more than what you'll want to know. There are probably hundreds of indicators that really help us determine what are the trends in healthcare, but again, retail and banking industries are probably something that the lay consumer of healthcare may not think about as what the future trends are for healthcare.
So how do you mean? I assume you're not talking about ATMs in the parking lot.
So think about how Amazon is changing the way in which we shop.
Right.
Well, think about how we are now providing healthcare virtually.
I see.
And so we are providing healthcare in more convenient locations, virtual visits, and you can have your physician office visit at home now. Similar to how Amazon is now delivering packages to your home versus having to go shopping elsewhere. Lots of similarities there. Also, how the banking industry has automated services.
Okay.
We are automating a lot of back-end services as well. And so there's a lot of work around artificial intelligence, predictive modeling that is prevalent in other industries, but is becoming much more prevalent in healthcare today.
Wow.
And that's not only related to back office functions, but also how the public and our consumers are receiving healthcare. And you think about the wearable devices that people have now to monitor their healthcare, and physicians are exactly your iWatch, and
it'll tell me if things are going bad.
That's right, and so we can measure.
So far, so good today.
You can measure your heart rate. Well, the physician can also measure your heart rate from your iWatch as well.
Wow.
And so there are some groundbreaking technology that's about to hit the market and about to hit Springfield, and so I think that is really exciting. Also, as far as what can we do as a community, so we've been blessed to have incredible education systems, from our public school system to our colleges and universities, being engaged in ensuring that the healthcare pipeline is secure. And so you think about GoCaps or Health Sciences Academy. Those are 2 programs that are very particular to Southwest Missouri and Springfield specifically, and have been great at developing that pipeline that Jill was referring to earlier, and we need to continue that. But also, we need to also navigate the way in which healthcare will be delivered, but also the spin-off services that healthcare is creating in the different trades that will be, I think, more prevalent as a result of that. And so how we develop our programming in our colleges and universities and also high schools is critical. Also, our community, there are several projects that are underway right now. We look at not only as our organizations as a place to work on being able to recruit and retain talent, but also Springfield and surrounding areas as a place to live. And so the projects that are underway in our communities is critical in seeing those to the finish line. One good example is the Jordan Valley Daylighting Project, critical to continuing to enhance downtown. That's attractive to our workforce and the workforce that we're trying to attract and retain. Also, the Grand Avenue Parkway extension is critical, tying downtown to middle part of town and making sure that tourists have that connection, but then also our folks that live in the area have that connection. And then also lastly, and Matt, I know you'll appreciate this, but convention center. Mm-hmm. We have got to expose more people across the nation to what Springfield has to offer. And we need to get a convention center over the line. That has been something that we've been continuing to talk about as a community for years now, and we need to see that over the line soon, and that will help us not only attract but retain the workforce moving forward.
I mean, if there's one thing that's just been made very evident through the course of the program today, it's the interconnectedness of our largest industry in Springfield, which is healthcare, and just the health of the broader community, economically and in every other way. And so what you're describing, Brent, I mean, they depend on each other. A growing, vibrant healthcare community depends on a growing, vibrant community generally, and vice versa. So I have one more question, and I'm going to let each of you answer. It's the hardest one yet, and that's because I'm going to limit us to just maybe a couple of sentences. And this is hard because I'm going to ask you in just a few words, if you could, kind of a lightning round, describe the future of the healthcare industry in Springfield. Go. You have one or two sentences. But no, if you look ahead to the future of Springfield, what's something that you think about as you look at what's ahead of us? Amy, you want to start us off?
I would just say opportunity for our community, for folks that either want to have a career change or have never considered healthcare before. Yeah. There is an educational institution in Southwest Missouri that can fit your needs.
Great. That's great. Brent?
Consumer-centric and groundbreaking.
Great. Wonderful.
I would say...
Bring us home, Jill.
Yeah,
Bring us home.
I would say the future is bright.
Yeah.
You know, here in this area, I often use this Springfield area as things that's doing it right. So we have amazing hospitals who are very innovative. We have workforce stakeholders and education in our hospitals working together collaboratively. And I think all of that just leads to a strong workforce, which leads to a strong community and a healthy community.
Well, Jill, Brent, Amy, thanks so much for taking a few minutes with us today. I think it's been enormously illuminating for us to be able to get a sense of how all these pieces fit together, and just appreciate the work that you're doing in our community and the support that you've provided, not just during this last year, but every day. Thanks so much.
Thanks for having us.
Thank you.
Bet. Well, as we wrap up, I'd like to thank our sponsors one more time for their support, and I'll offer a special thanks, of course, to our presenting sponsors, Cox Health and Mercy, for their support of this event and this program. We'd also like to thank the tremendous team at Southwest Audio Visual for their help in making today's event happen. Goodness, we've learned how to rely on those guys a lot over the course of the last year or so. And of course, the team here at the Oasis Hotel and Convention Center has been a tremendous host to us as always as well, so thank you very much also. Last, but certainly not least, we hope that all of you who are watching online have enjoyed today's program and learned something that you can apply, taking away from it to the future health of our community, both our physical health and well-being, our mental health, and of course the overall growth and future of our community as well. I want to thank you for joining us for the 2021 Healthcare Outlook, and thank you for being a part of the Springfield Area Chamber of Commerce. We'll see you soon. Until then, be well.